Okay, so we have Alvin here with us today. Alvin, thank you for joining us.
Thank you for having me.
State your full name and the organization that you work for?
Sure. I'm Alvin McCoy, and I work for Pelaia-Krumhansl Health Center.
Wonderful. Thank you so much for joining us today for CHW Day. I hope you've been enjoying the activities so far.
Absolutely have.
Awesome. So we're so happy to have you here just to ask you a few questions about the important work that you do.
Sure.
The first thing I'd like to dive into is, can you tell us a little bit about Care Alliance Health Center?
Sure. So Care Alliance, we're a full-service health clinic. We are conveniently located in Cleveland, Ohio. Some of our locations are like close to downtown. We're on 30th and Central, 60th and Woodland, and we do just about everything there. We do medical, we do dental, we have our own mobile units, we have our own transportation, and we have our community health workers such as myself.
Perfect. Care Alliance does offer amazing comprehensive services and wonderful, wonderful organization.
Yes,
so as far as your work as a CHW, I would love to know what advice that you would give to somebody who is interested in becoming a community health worker themselves.
Oh, that's an excellent question. I would say it would start with, having the desire to help people, because that's mainly what you'll be doing in this role, helping individuals with their needs. So I would say start with that, and then go on to the education piece of it, wherever you decide to get your education from. Get your education, get educated in it, and then, go out and seek a company that aligns with some of your values and what you're trying to do, because the community health worker has so many different roles that they can do. You have to kind of narrow it down to the exact role that you can see yourself doing.
Mm-hmm. Sure. And yeah, I mean, the work of community health workers really does span a lot of different facets of care. What is your favorite piece of that?
That's a good question. So I would say it would lean more towards helping people with their needs, screening people, helping them schedule appointments, helping them with their barriers, whether it be food insecurities, employment, housing, anything like that. I enjoy helping people with and connecting them to those resources.
And this actually segues right into the next question. Describe the average day as a day in the life of a community health worker.
Oh, sure. So no 2 days are the same. The average day for me will be, answering emails, answering phone calls, using the Pathway Community Hub, using Unitas to connect people to resources, getting referrals through them, whether it be, like I said, through the Community Health Hub or any type of partnership we have, which could be the Greater Cleveland Food Bank, just a plethora of different organizations around town. And, getting those people in for whatever they need, medical services, food, even kind of enrolling people in Medicaid or SNAP benefits. So we do that as well.
Wonderful. It's so much comprehensive work that CHWs
Absolutely,
do.
yeah.
I mean, really, the more I learn, the more I'm just blown away.
It's a lot of different hats they wear. They can be a Swiss Army knife at times, because depending what organization you go to, they may use you in different capacities. So, yeah.
Can you explain, obviously prevention plays a huge piece of this, but can you explain how CHWs are essential to public health?
Sure. They're a trusted, person in the community that has a lot of different resources. So things that you may not be familiar with, a community health worker may have that resource for you, or they may know that resource for you. Mm-hmm. Their job is to use different platforms like Unitas and the Community Pathway Hubs to address some of those needs there. And we're able to screen them and that process and find out exactly what they need that may help them. So community health workers are a very central part, because like I heard someone say, they're a bridge for most people. They're a bridge between you and that provider. They're a bridge between you and that resource. So I would say that's how they're most effective, being a bridge for people in the community. And like myself, seeing that I come from the community that I work in, people are able to be familiar with me because they see me in the community. They know I come from that community. And so that gives them the trust they need to come up to me and say, hey, Alvin, do you know anyone who can help me with finding an apartment? Or do you know anyone who can help me for furniture or something like that? So, yeah.
And trust has really been a theme of the work that the community health workers really do in relationship building. So it's great to hear that from you too. Sure. So, well, great. Thank you so much, Alvin, for taking the time to join us on this podcast. And I hope you enjoy the rest of CHW Day today. And thank you for all the work you do.
Thank you, Libbey.
Thank you so much.